After inoculating the older population and population with comorbidities, the government on April 20th extended the COVID-19 vaccination drive to a larger and younger population group by opening up registration to those in 18 to 48 age bracket. India has 59.46 crore people under this age category, out of which by the end of the day almost 1.33 crore registered themselves to get vaccinated. The scale of Russian vaccination is an average of 25 to 30 lakh doses a day. Now, the registration of 1.33 crore people on the very first day indicates the daunting task the government will be facing when the vaccination drive kicks in the coming weeks. Even doctors have indicated that a huge pressure is expected as many young men and women will seek vaccination and would want to get back to work at the earliest. Secondly, with the number of deaths in the country, people who were even a little hesitant about the vaccine will now opt to get vaccinated. So here's some of the important things you need to know if you fall under this category. First of all, you have to register yourself on CoWIN app. The government says that citizens aged 18 to 44 years should mandatorily register themselves and schedule appointments online before going to the vaccination center. On-spot registration or walk-in facility is currently not allowed at private hospitals for this age group. Registration is completely free. You don't have to pay anything to register yourself to get vaccinated. Secondly, would you be able to register yourself on after 1st of May? Now, that will depend on the availability of the doses in your state. From May 1st, state governments and private hospitals will procure 50% of total doses directly from the open market to vaccinate the 18 to 44 year age group. Since we do not have sufficient vaccines to cover everyone, several states will have their own priority groups within this age category. This state-specific information will soon get reflected on the CoWIN app when you make an appointment for the vaccination. Another concern is the pricing here. Will it be free for all, or the same prices will apply as it did for 45 year and above category? Now, for people above 45 will continue getting their vaccines for free in government hospitals and at ₹250 at private hospitals. But for people between 18 to 44, the pricing is not yet decided. Some states have announced that the vaccine will be free of cost at government hospitals, but other states are yet to announce the policy relating to the payment. However, at private vaccination sites, the cost will be decided by the private hospitals itself, and you can see the price of each vaccine at the time of booking. The system from May 1st will show the price of the vaccine below the name of the vaccination center at the time of booking an appointment. Now, will you be able to choose your vaccine? Yes, you can. The app will show which vaccine is being administered in which vaccination center at the time of booking an appointment. In the app, you'll be able to see which vaccine center is administering which vaccine, and based on that information available, you can book your appointment in that particular vaccination site. Now, this is only for the private hospitals. This choice will not be available at government hospitals. Now, the major question here is there enough vaccine for everyone? Now, vaccine shortage is something that states have been complaining about even before the third phase of vaccination was announced. Reports from cities in most states also suggests that users in the 18 to 44 age group could not find appointment slots for vaccination. While some did secure dates as early as the first 2 weeks of May in places like Ranchi, however, most hospitals in states including Gujarat, Chandigarh, Delhi, Chhattisgarh, West Bengal, Maharashtra, Tamil Nadu, Bihar and Assam displayed unavailability of slots for those under the age of 45. Chhattisgarh Chief Minister said the state had placed order of 25 lakh vaccines each with Bharat's Biotech and Serum Institutes of India. But Bharat Biotech replied and said that it could supply vaccine only by the July end. He added that the state is capable of vaccinating 3 lakh people per day, even if the center informs them a couple of days before May 1st. But the lack of stock is an issue. He fears that the vaccine strategy might fail. The situation in Maharashtra is quite similar. The state requires around 40 lakh vaccines a week, but the state's vaccine stock is around 7 lakhs only. While the state has the capacity to immunize 8 lakh people a day, it was only able to vaccinate only 1.5 to 2 lakh people on Tuesday due to the unavailability of the stock. In Mumbai, 40 out of 73 private COVID-19 vaccination centers in the city will remain closed today due to the insufficient vaccine stock. People are either asked to go to private hospitals, and people who have received their first dose are being prioritized at the moment. Even the Rajasthan Health Minister Raghu Sharma said that there are 3.25 crore people in the state who fall into this age category. The state needs around 7 crore doses. The health minister said that the state has given an order of 3.75 crore vaccines to Serum Institute, but was told the company would only be fulfilling the order placed by the center till May 15th. Now, some of the worst hit states are also facing similar issues. Odisha Health Department officials said that the center has failed to supply adequate doses of vaccine, and due to the unavailability of vaccine, the phase 3 vaccination drive is likely to be delayed in the state. In West Bengal, many people who received their first dose of vaccine are still waiting to receive their second dose. While the officials say that they are waiting for more clarity on the third phase of the vaccination drive, hospitals say that they do not have a clear answer from vaccine manufacturers. Jharkhand has also written to the center asking for 50 lakh doses of vaccine, but the center has not replied to its request. The health experts have also warned that India is likely to face extreme shortage of COVID-19 vaccines if all adults eligible for vaccination being queuing up for the jabs from May 1st. Experts also pointed out that the center's revised vaccination policies more than double the population of the potential vaccine beneficiaries without immediate provision for the extra doses needed is very problematic. India currently has access to about 70 million doses per month of the Serum Institute of India's Covishield and about 20 million doses per month of Bharat Biotech's Covaxin. The third phase of vaccinations will increase demand significantly without a clear pathway to increasing this supply. The vaccines coming from different countries could ease the situation, but the timeline on those vaccines are yet to be entirely clear. Experts predict the shortage will intensify in the coming weeks. The center has said that it would procure 50% of the doses and distribute them to states, while states and private hospitals would be free to procure the rest of the 50% doses on their own from manufacturers directly. Both the Serum Institute and Bharat Biotech have indicated that in the first few weeks they would only have limited stocks to distribute to private hospitals. In private hospitals, Covishield would be priced at Rs 600 and Covaxin at Rs 1200. On Wednesday, Adar Poonawalla announced that he had cut the price of Covishield for states from Rs 400 to 300 per dose. Serum Institute has also communicated to the private vaccination sites that it won't be able to deliver the vaccine dose for the next 5 to 6 months. The center earlier this month also announced financial support to the vaccine makers to help them increase their production capacity.